हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। आइडेंटिफाई द फॉल्स स्टेटमेंट रिगार्डिंग मैनेजमेंट ऑफ एनास्टेमी. Aspirin loading dose should be initiated immediately. Yes, is right. ACC or AHA guideline call for either P2Y12 inhibitor, clopidogrel, prasugrel, ticagrelor. True. Glycoprotein 2BR3 inhibitor are useful adjacent to fibrinolytic therapy is useful in acute coronary syndrome without ST segment evaluation. This one is wrong because the fibrinolytic therapy is not recommended for anastomy because the underlying cause of a condition is not a complete occlusion of a coronary artery of blood clot. Fibrinolytic therapy is typically reversed for a patient with STEMI. Reverse the STEMI and ST segment elevation, myocardial infarction. Who has the evidence of a complete occlusion of coronary artery? Next question, what is the diagnosis of a patient who exhibit dyspnea and increased distension of neck veins upon inspiration with no murmur detected? The best answer is the constructive pericarditis, because the constructive pericarditis is a condition of the characteristics inflammation and fibrosis where pericardium of the pericardium. This leading stiffness of the pericardium, impairing the ability of the heart to expand and fill properly during diastole. The key clinical feature include dyspnea and distended neck veins that increase the inspiration. इसको क्या बोलते हैं? known as cosmal sign. And during the inspiration, the intrathoracic pressure decrease causes on the increase in venous return to the heart. In constructive pericarditis, the rigid pericardium prevents the heart from expanding adequately, resulting in an exaggerate rise in jugular venous pressure, and this also result in muffled heart sound or absence of murmur and usually show pericardial friction rub. Next question, which medication decrease mortality in individuals suffering from heart failure? Metoprolol. Very important question, because the metoprolol, what is the beta blocker? क्या है ये? Beta blocker has been shown the lower mortality in heart failure patient. And ACE inhibitor also has been shown to decrease mortality in patient with heart failure. Next question, what is the most likely condition for a male condition who has been experiencing limb weakness? See the key point, and sensory loss for 3 months along with angular stomatis. In the examination, the patient shows a lack of proprioception and vibration sensation, upper motor neuron type weakness in the lower limbs, and no ankle reflex. The direct of the proprioception of subacute combined degeneration of the cord, because here the clinical presentation suggests to a subacute combined degeneration of cord due to deficiency of vitamin B12 deficiency. According to the vignette, the patient has the stalking light disturbance of loss of proprioception, vibration cessation, and upper motor neuron type of the lower limb weakness. Has also a angular stomatis. Both neurological and dermatological findings are suggestive of vitamin B12 deficiency in the patient. Very, very important question. Next question, a 40-year-old female patient with palpitation and difficulty in breathing. Auscultation reveals a mild diastolic murmur and JPP shows a prominent E wave. See, what is the most likely diagnosis? If the prominent A wave is what? Tricuspid stenosis. because the mild diastolic murmur is seen in tricuspid stenosis and mitral stenosis. Mitral stenosis. Prominent A wave is seen in tricuspid stenosis. It is also seen in long-standing mitral valve. Long-standing mitral valve, where the pulmonary artery hypertension will be present. Since no feature of PAH are present in patient, and mitral stenosis can be ruled out. Next question: in a patient who is a chronic smoker, bilateral pedal edema and abdominal distension were observed. Further examination showed the presence of ascites and an S3 sound during auscultation. What are the possible defects that can be observed in the patient? Tricuspid regurgitation. Because the clinical finding in the patient reveals reciprocal pitting pedal edema. Ascites on S3 auscultation are suggestive of what? Right ventricular failure. Here, the history of the chronic smoking likely suggests that the patients suffering from chronic obstructive pulmonary disease leading to a core pulmonale. What leading to a core pulmonale? Leading to a core pulmonale. Here, the right ventricle failure due to what? Non-cardiogenic cause and increase RV. Here the increase RV pressure leads to tricuspid regurgitation. So today that's all. Thank you and keep revising.